Good afternoon, everyone, and thank you for coming. This is a very special day in Fort Bend County. Yesterday was a victory for Fort Bend County children, the employees, residents, and parents. I'm pleased that Honorable Judge Becerra of 434th Judicial District Court upheld Fort Bend County's authority to mandate face covering in county buildings despite Governor Abbott's executive order prohibiting them. In essence, this denies Governor Abbott's attempt to appeal the temporary restraining order that is granted to the county last Wednesday, which is August 11th, by the District Court Judge Kristen Becerra. The win in the battle yesterday was really heartfelt because it gives us, when I say us, I mean the county, the municipalities, the school districts, health authorities, and other government officials in Fort Bend County, an opportunity to do the right thing when it comes to practicing, protecting our citizens, our families, and our most vulnerable, our children. At a time when we need to be together, we need to be focused on the well-being and health and safety of all our people in our county, in our state. It is unfortunate we have to fight in this aspect. But my message, if we have to fight, we will fight, because I took an oath to protect and care for our citizens at every level, and especially when it comes to our children. And this is, I really don't understand. One thing I know that I wanted to be, one thing I really know that I wanted to be on the right side of the history. I know that I am on the right side of the history. And at this time, and that's why we are doing everything within our power to open the door and clear the pathway for our schools to act now, care for our children. Our children are our future, and do the right thing. Every day, every hour, every minute we wait, we adults are failing to protect the most vulnerable, our children. Our schools have a responsibility as a civilized society to protect our children and care for them. And let's do the right thing. And history is going to be on our side, as I mentioned before. And we all know that. Face covering it is proven to be effective. Vaccination has proven to be effective. And physical distancing has proven to be effective. This is all, we all know that that's the few tools we have to fight this pandemic. And joining me today to provide their perspective from the front line and discussing breaking news, and you all know that in the medical center area, in this greater Houston area, things are very different, and I want them to explain the latest news regarding our hospitals, patient care, and latest, what is happening when it comes to COVID-19 and how our medical professionals are fighting this fight. People, this is a war, and they are the frontline soldiers fighting this fight for us. And we need to give them the tool. We need to help them so that they can do their job. And I just wanted to invite, and I'm so honored, I'm joined by a few of the medical professionals here. In the middle of this fight and in the middle of this busy time, they took some time to come and visit us and tell us their perspective and what they're seeing. And I wanted to invite Dr. Faisal Masood, Medical Director, Center for Critical Care, Houston Methodist Hospital. Doctor, please come forward.
Thank you, Judge. Good afternoon. I represent the nurses, the doctors, the respiratory therapists, all the people who have been dealing with this since March 6, 2020. And the hospital, Methodist hospital system has patients in hospital all across the greater Houston, including Fort Bragg County. I would have never thought last year that this will be something I'll be talking in 2021. But the grim reality is that we have more cases now than ever before in our hospital system. And not only in our hospital system, but all across our colleagues in different hospitals. We've got more patients in our emergency room waiting for a bed than ever before. This doesn't have to be like that. There is so much ample data which is different than last year. Last year we didn't really have all the treatments, all the prevention things. We had masks, we had treatments. But this now we have vaccines. There is an ample data available from UK, from Israel, from even US that vaccines actively save lives. Recently published studies showed that 140,000 lives by May were already saved in the US alone. So this is such a preventable thing. Most of the hospitals across the country, especially the southern states, including Texas, in which the vaccination rate is on the lower end of the spectrum, most of the patients, I'm talking about 80 to 90% of the patients in the hospital, in the ICUs, are unvaccinated. It doesn't have to be like that. Patients which are used to be around 65, 75, now you're a 20-year-old, 25, 30-year-old, are in the hospital and sick in the ICU. It doesn't have to be like that. We have the treatments. These masks, why the mask now compared to masks 4 months ago when CDC said you can go out and be in gathering without mask? Because the Delta variant, it is so spread, it is so transmissible, because even in the vaccinated people, they can give it to others. It's about shared protection. That means we have to protect even if we are vaccinated. That means everybody has a responsibility to wearing masks. One thing I want to remind everybody, that this COVID pandemic doesn't not only affect the COVID patients. If you are having a heart attack, if you're having a stroke, if you have your loved one having some cancer or heart surgery thing, they can't get a bed. They can't get the surgery done. What is their fault? It doesn't have to be like that. We all are in this together. And lastly, I want to remind people that the doctors, the nurses, the respiratory therapists, the cleaning people have been doing this for last year. And just to give an analogy, this is the 4th tour of duty for them. They are tired, they're exhausted, and they're so much short that approximately estimation there 6,000 nurses are needed in Texas hospital. We don't want to be there. We want to be there when you are having a heart attack. We want to be there when you're having COVID. We want to be there when you're having surgery done. We can do all this together by vaccinating, by masks. There's so much evidence there. Please, we're fighting not only a pandemic war, but an infodemic. We're all in this together. Virus is the enemy. We all have to care for each other. It doesn't have to be like this. Please vaccinate. Please put mask on, and we will get through this thing, not only for adults, for our own families, but for our children also. Thank you so much.
Thank you, Doctor. And also we are actually definitely fortunate Dr. Stan Spinner, the Vice President and Chief Medical Officer of Texas Children's Pediatrics and Texas Children's Urgent Care. Doctor, please come forward. Thank you.
Thank you. It's an honor to be here. Good afternoon. So I represent Texas Children's Pediatrics and Texas Children's Urgent Care. We have 50 pediatric practices in the greater Houston area. We also have 11 urgent care sites. We're also part of Texas Children's Hospital System. As you know, Texas Children's Hospital is the largest hospital in the United States. We take care of so many sick kids. We have done so for many, many years. And we are there to take care of the most vulnerable children. And as a pediatrician, our goal is to be sure our kids are safe, to take care of them. As physicians, we take an oath, above all, do no harm. We need to be sure that we are all standing firm in being able to do what's right for our kids, keep them safe. And unlike earlier in the pandemic, when everyone was hearing about children really are not being affected by COVID, they usually do well. And thank goodness that's been the case. But we're seeing those things start to change. Today we're seeing about 200 children test positive for COVID just at Texas Children's every day. And that's those just that are being tested. We know many families aren't having their kids tested, but they're still sick. And of those kids being tested, 5 to 10% of them are being admitted to Texas Children's Hospital, and about a third of those are ending up in the intensive care unit. So our kids are getting sick at greater numbers, and they're getting sicker at greater numbers as a result of the Delta variant. But we're also dealing with something a little different than in the adult world, because our children that are under 12 can't be vaccinated, even if the families want them to. So even more of a reason for these vulnerable children that we have to do everything possible to protect them. And as we protect one, we protect all. We protect ourselves, we protect each other. So the need for wearing a mask is so important, especially as our kids return to schools. Getting into public areas where they can't be physically distanced, where they have to be in school. We want them to be in school. But in schools where they need to be protected, we are already seeing the numbers of children getting sick as schools are just getting started with COVID, and the number of kids being quarantined. And the largest school district, HISD, hasn't even opened yet. So we really, really want to be aware of, we need to do what's right for ourselves and for our children. This isn't about anything else. It's about doing everything possible to protect each other. This is a public health priority. This isn't a personal issue. This is a public health issue. And again, as a pediatrician, as I represent so many of our pediatricians who work, Dr. Singh being one of our physicians, they are beyond the stress point. You know what's going on in the hospitals. We see it on TV, but it's also going on in all of our primary care practices. We don't have the time to see all of our kids. We're extending our hours for our pediatric practices. We're extending the hours for our urgent care. We're doing telemedicine into the wee hours of the morning to manage children. But again, many of them are getting sick with other things. The masks came off this summer, and RSV, respiratory syncytial virus, which is a very common yearly fall and winter virus in our children, it was gone last year. We didn't see it. We didn't see flu last year because kids were masked. This year the mask came off, and we are being inundated with RSV at a time that we never have seen it before. So again, more evidence that masks do what they're intended to do. They prevent spread of respiratory infection. So please, everyone, do your job, do what's right, take care of yourselves, but take care of your children. Thank you.
Thank you, Doctor. Really appreciate both of you sharing your insight, and I tell you, I used to be a school board member, and I always say this, children, they don't care wearing these masks. And I went to a private school a few days ago. Every little one is wearing little colored mask, and they're not complaining about it. And I learned this, adults are the problem. And also think about it for a second. What are you fighting here? And saving life, that's what we are fighting here. And for sure I could say that those who are against, those who are fighting, those who are against masks and those who are against vaccination, and I tell you this, you are on the wrong side of the history. And it is absolutely clear. And we know this fight is not over. I'm talking about the legal battle is not over, and it is highly likely going to be appealed in a higher court. But I am committed to seeing this through to the end and will not be moved. And we will continue to, I will not be moved from my decision, I repeat, to listen to our health officials, our doctors, and our health authority. And also, I'm not going to be deviating from science and data. And that's how we fight this that's how we fight this enemy, which we cannot see it, where it is and how it is attacking us. That's how we fight it. And my message is very simple. Let's all work together. Let's all work together. Help us to help you. If you are a Fort Bend County resident, help us to help you. And I wanted to thank, definitely you heard Dr. Spinner was talking about Dr. Sapna Singh. She happened to be a good friend and community leader and a pediatrician caring for our children here, right here in Fort Bend County. And sometime I call and talk to Dr. Singh and, what you're seeing. And, we have a conversation where sometime we both are saying, We don't know why people are fighting these things. I'm the one dealing with these children. I'm putting my life on the line and going, and I will do anything and everything to save your children. But you know what? You need to do your part. That's the conversation we always have. And I just wanted to say this. Also, when coming back to the legal, fight we are having, I wanted to thank Judge Becerra, and I wanted to thank our county attorney's office. Numerous of our legal expert worked behind the scene to make that happen, and also our local health authority and our county government, all with this fight, at least for time being, we could do what is right. We could do what we're supposed to be doing, which is saving life, saving especially our most vulnerable, our children's life. And we will continue to do that. And I just want to leave you with this. Have this full confidence, as long as I'm here, and I will take the step. If I had to take second time, third time, I will definitely do that, because I always said this, I believe in human life, and I believe in human dignity. And our children are the most vulnerable. We will continue to fight for them and their life. With that, we will conclude this discussion here. If you have any question, we would be able to answer that now.
Judge, you mentioned that this case will likely be appealed. This ruling will likely be appealed. Most legal experts we talked to expect it to go all the way up to the Texas Supreme Court. How long do you think it could be until they potentially take up this case? How much time does that buy you, and what impact could that have with being able to require masks?
Honestly, I don't want to speculate what they're going to do with our case, and obviously that some of these parties fighting have COVID now, so things will change. Every day things can change. So I don't want to really. I don't have any speculation when they will go, how much time we have. We are taking one day at a time, and we will continue to watch, and our county attorney's office is constantly watching what is happening. So as and when things develop, we will communicate with you. Yes, sir.
So, clearly a big part of this is trying to protect children. Have you been in any talks with the school districts? It seems like they still haven't instituted mandates.
See, as you know, we all are talking about local authorities, their ability to do the work, do the right thing by their constituent, and especially when it comes to school district, that is, our children. And so we don't want to, and we give that power to the local school district board. And I believe, and I strongly believe, they will do the right thing, and they should do the right thing, and by mandating the face covering. And also, I just want people to know this. This is not forever. Maybe it is for 1 month. Maybe it is for 6 weeks. It's not forever. Let's get together and do it. And please don't fight science, and please don't fight data and medical experts. This is a war we have to fight together.
Can the county enforce mask mandates in schools?
We haven't looked into it, and and like I said, I always like to give that freedom to the local authority. And if I do something like that, then I am going against what I'm saying, complaining about Governor Abbott. So I never wanted to do that, and so they have the freedom. Their hands, initially some of the school board said this, our hands are tied. Listen to me, your hands are no more tied. Go do the right thing.
What do you say to parents that don't believe in masks?
That's a good question. so doesn't believe in masks. That's why I said we believe in science. We believe in experts standing behind us. We believe in medical science, and we know that numerous studies, and I will ask our doctors to respond to that, because we know that face covering work. And face covering is nothing new. We have been doing that for ages, maybe. And so it worked, and so I hope they need to do their research at the right place and get to the conclusion, but it will work.
Teachers that are afraid of getting COVID, how do you encourage them to stay, or what do you tell them?
And that's again coming back to the school board. And you know what? If we don't have teachers, we cannot teach our children. And it is, of course, it is start with our children, but our educators are equally important. If we don't have educators, we cannot educate our children. And that's the reason why I'm again recommending, again urging the school district to do the right thing and requiring face covering, at least for time being. And we will prevail, and there is no doubt. Let's come together. I'm repeating. I know that I'm repeating. Let's come together and defeat this enemy for good.
One more question. What do you tell parents and students that don't want to wear masks?
Say that again?
What do you tell parents and students that don't want to wear masks?
What do I tell them? I tell them you need to, understand what is going on. Like I said, face covering work, and it work. And when you ask these people are wearing this for ages. I mean, when they go into the hospital, any medical facility, they are wearing it. It work. And you know what? Come out of your false thinking and get the right information. Face covering work. And you know what? It is about, end of the day, it is about saving life. And that's what we do. Let's all come together. Let's all come together and work together to make our citizens, our children's life better, not putting them into hospitals. You heard from the doctors, they're saying they're seeing these numbers on even children going up. And we don't want that. We really don't want that. And, Dr. Faisal Masood was keep repeating, you don't have to. We don't have to be there. We don't have, you heard that many times. And you know what? I'm saying the same thing. We don't have to be fighting this the way we are fighting. And so let's get together and, let's do the right thing for our community. Thank you.
Sir, what are your thoughts on the particular school that implemented masks as a dress code?
And again, and that dress code is created or changed by the school board. So it is, end of the day, that school board's responsibility. It is about the will of the school board. They are the governing body for that school district, and they decided to change that dress code. And you know what? If that works, I'm all for it. I'm all for it.
Thank you so much.
Thank you. Thank you. One more question? What is?
Yeah, I was just going to ask, you mentioned this as a temporary measure. What's the goal? Is it to get hospitals at a more manageable level? Is it to wait until children?
We always look at the data. I mean, that's how we raise our threat level and lower our threat level. It is absolutely about the data, and we are watching it, and I'm sure our medical experts will tell you the same thing. We are watching it on a daily basis, what is happening, and things get better. We will announce it. We will lower the threat level. We will go back to hopefully normal life soon, and that is the idea behind all these activities. And so let's continue to do that. Let's continue to do this measures we are talking about, face covering and getting vaccinated. And also think about it, 166 million Americans got vaccinated already. Come on, I don't know what it takes to convince some people. For me, that is more than enough. So please go get vaccinated. And also in Fort Bend County, you just walk in. You don't need an appointment. You don't need anything of that sort. Before, you have to get in and get called in, and you have to get an appointment and all that stuff. No, just you walk in and get vaccinated. 5 minutes, 10 minutes, you're out of there. And we are here to serve you. This enough vaccine we have, and we will continue to serve you. Let's continue to work together to fight this COVID. Thank you.
Thank you. Have a good day.
Oh.
Thank you.